My name is Megan Brown. I'm the Nurse Unit Manager of the Paediatric Unit, Special Care Nursery and the Paediatric Hospital in the Home here at Maitland. I've been here for 5 years.
And I'm Dr. Jerry Santos. I'm one of the staff specialists full-time here in Pediatric Department. I've been working here for 5 years.
In our paediatric unit, we look after babies from naught and then children up to about 16 years old. In our unit, we look after medical conditions and surgical conditions as well. So our children are looked after by our paediatric medical team, as well as some of our adult physicians from the surgical and orthopaedic and gynecology services. Hospital's a really scary place for kids. It's really frightening. We're all new people. Our uniforms can be frightening. The environment, the machines, the beeping, the sounds. So we have to be really mindful of that when they're in hospital. So when we're looking at spaces, we're trying to make them safe,
Yes.
like physically safe for children.
Well, I like hearing families thanking us after their stay and saying that we have enough time to sit down and talk to them.
I've been poring over the plans and being very heavily involved in that, and we are thinking about what the space looks like and feels like for our children and their families when we move to the new space.
For the new hospital, the most that I'll be looking forward to is really the family-centeredness of our new space. So I really look forward to that.
Our nursery at the moment is quite open, but we'll still be open in the new hospital, but with a lot more privacy and individual bays for the babies. In the paediatric unit, we will have a dedicated day stay space. So we do have children that come in for surgery that are only stayed during the daytime or for short procedures. And so to have a really dedicated 4-bedded space for that is really important, that you can have those children in that space rather than mixing in the rest of the unit as well. Children deal a lot with what happens in their lives through play, so it's really very important that we provide those spaces for them. Looking after children and babies and families on the best and worst day of their life for that family, and I think we really come together to support each other in that as well, and that will certainly carry through to the new hospital and to the new patients and new families that we look after.